Hey, future top-notch nurses, have you ever wondered what makes a patient education plan truly effective? How do you ensure your patients actually understand what you're teaching them? Let's break down the essential components that every nurse needs to know. Ready for a quick quiz? The nurse must include which of the following components in the education plan? Select all that apply. 1. Objectives. 2. Content and time allotment. 3. Teaching and learning resources. 4. Evaluation parameters. Is it A, 2, 3 and 4, B, 1, 3 and 4, C, 1, 2, 3 and 4, D, 1, 2 and 3? Take a moment to think. Got your answer? If you chose C, you are absolutely correct. All 4 components, objectives, content and time, teaching resources and evaluation, are crucial. Let's dive into why. A comprehensive education plan needs every single one of these elements to work. Think of it like building a house. First, you need the blueprints, which are your objectives. These establish clear, measurable learning goals. What should the patient be able to do or understand by the end? Next is your content and time allotment. This is like the foundation and the framing of your house. It ensures that all the necessary information is organized and scheduled appropriately. You need a structured plan to deliver the content logically, without rushing or overwhelming the patient. Then, you have your teaching and learning resources. These are the tools and materials you use to build the house, like pamphlets, videos, or hands-on demonstrations. These resources provide the necessary methods for effective instruction and help cater to different learning styles. Finally, you need evaluation parameters. This is your final inspection. This component allows you to assess whether the patient has actually achieved the learning objectives. How will you know they've learned? Through return demonstrations, quizzes, or simply by having them explain it back to you? So, why are the other options incorrect? Option A is missing objectives, so you have no clear goal. Option B lacks content and time allotment, meaning there's no structured plan for delivery. And option D is missing evaluation, so you have no way to measure if your teaching was successful. Simply put, all 4 components are critical for a structured and successful patient education plan. Here's your RN Masterclass moment. A complete education plan must include objectives, content and time allotment, teaching resources, and evaluation to be truly effective. And to help you remember this, use the mnemonic OCTE. That's objectives, content, teaching resources, and evaluation. Always remember OCTE, so you never forget the core components of a solid patient education plan. To all the nursing students out there, remember that a structured plan is your best tool for ensuring your patients learn effectively, leading to better health outcomes. If you found this helpful, please give this video a thumbs up, subscribe to the channel, and hit that notification bell. Share it with your fellow nursing students, and stay tuned for our next RN Masterclass lecture, your daily NLE prep companion. Thanks for watching.